My name is Blair Lober, and I will be presenting my project, Weight Management and Telehealth, Improving Outcomes with Patient Engagement. I would like to thank my project team members for all of their encouragement and feedback during this project. This project was conducted to assess telehealth engagement tools on the treatment of obesity. Obesity is a growing epidemic with significant health risks, including diabetes, heart disease, cancer, and many more. The average obesity rate in Alabama is around 39%, and the national average is around 32%. These rates have continued to rise over the last several years. Many social determinants play a role in the rising obesity rates. Barriers such as poverty, limited access to health care, and inadequate resources contribute to these high obesity rates. Telehealth has emerged as a promising option to bridge geographical and logistical gaps to deliver accessible, patient-centered care. Integrating engagement tools within telehealth platforms can empower and encourage patients to become active participants in their healthcare, improving outcomes and revolutionizing the management of chronic conditions like obesity. I have worked at Coastal Health, a primary care practice, since 2017. In 2020, COVID pushed many of the office visits to telemedicine, and the practice, Omnia Telehealth, was created. OT's physical office is located in Spanish Fort, Alabama. However, the practice serves patients across 18 states using a cash pay model. While OT treats many different conditions, weight management makes up approximately 80 to 90% of the monthly visit volume. OT services have been instrumental in increasing access to weight management care over the last few years. However, improving patient engagement and satisfaction has remained a critical area for growth within the practice. OT's traditional weight management telehealth program included monthly telemedicine visits and medication management, but gaps in patient adherence and satisfaction highlighted the need for innovative strategies to optimize outcomes. This project aimed to address these gaps by integrating patient engagement software into OT's existing weight management program. The project was guided using the PICO question. In adults with obesity, how does participation in a telehealth weight management program utilizing patient engagement software compared to traditional weight management interventions affect body weight, adherence, and patient satisfaction? A review of literature was conducted using CINAHL and Medline databases. 13 studies were reviewed based on the search terms telehealth, engagement, patient satisfaction, and obesity management. Recommendations based on the review of literature were that including engagement software as part of a telehealth weight management program should be considered in the treatment of obesity. Patients utilizing engagement tools in telehealth had significant weight loss, with higher engagement leading to greater weight loss and improved health outcomes. In addition, patients using telehealth and mobile health engagement tools had equal or higher patient satisfaction rates compared to traditional visits. To implement the project, OT integrated a new platform called Healthy into the current telehealth weight management program. New weight loss patients, ages 18 to 75, with a BMI of 27 or higher, were enrolled into the Healthy 12-week weight loss program. These patients were prescribed either semaglutide or tirzepatide, which are once-per-week injections used in the treatment of obesity. 50 patients were enrolled. However, only 34 completed the 12-week program. Patients enrolled in the Healthy program had access to engagement tools within the app. Within the app, patients were able to track their weight, diet, exercise, and many other metrics. Patients could complete questionnaires, create and complete goals, and had access to educational tools and meal plans. Outcomes measured included weight reduction, engagement, adherence, and patient satisfaction. These outcomes were compared to the control group, which consisted of 19 individuals who completed 12 weeks of the traditional program. The Healthy platform is an all-in-one interactive EHR for providers and patients. Within the Healthy platform, we created a 12-week weight loss program, and patients within the Healthy intervention group were added to this program. The 12-week program had scheduled modules for patients to complete with automated reminders. The modules included weekly weight tracking, biweekly adherence questionnaires, and educational tools. In addition, the program included goals and meal plans. Patients were able and encouraged to check off each module and goal as they were completed. While the Healthy 12-week weight loss program was only available to the intervention group, the adherence questionnaire and satisfaction survey were completed by both the Healthy intervention group and the control group. The adherence questionnaire consisted of 5 questions evaluating patients' adherence to key aspects of the weight management protocol, which included weekly weight tracking, medication use, diet, exercise, and water intake. The satisfaction survey was a 20-item modified version of the patient satisfaction scale for telemedicine, developed by Do and Gu. It included questions regarding ease of use, provider communication, privacy, and overall satisfaction with the telehealth program. Responses were scored on a 5-point Likert scale, with higher scores indicating greater satisfaction. Different statistical methods were used to compare results between the intervention and control groups. The intervention group consisted of 34 participants, and the control group consisted of 19 participants who had previously completed 12 weeks of the traditional telehealth weight management program. Descriptive statistics, including mean and standard deviation, were used to summarize participants' baseline demographics. Mean age in the intervention group was 39.2 years and 48.2 years in the control group. 65% of the intervention group was female and 74% of the control group was female. The mean height of the intervention group was 66.71 inches and 66.47 inches in the control group. The mean weight of the intervention group was 217.5 pounds, and mean BMI was 34.12. The mean weight of the control group was 210.7 pounds, and mean BMI was 33.3. A comparative analysis between the intervention and control groups was conducted using Welch's t-test to evaluate differences in mean weight loss, BMI reduction, patient adherence, and patient satisfaction. Statistical significance was set at a p-value of less than 0.05. Over 12 weeks, the intervention group had significantly greater mean weight loss, reduction in BMI, adherence rate, and satisfaction scores. The difference for mean weight loss was 6.21 pounds. The difference for mean BMI reduction was 0.9 units, and there was a mean difference of 31.55% for adherence rate and 0.33 points for patient satisfaction. The difference in means between the intervention and control groups for each of these outcomes was statistically significant. Patient engagement was analyzed in the healthy intervention group with a mean engagement rate of 58.21%. The engagement rate was calculated as a percentage of the possible 20 engagement opportunities completed. These opportunities included 12 weekly weigh-ins, 5 biweekly adherence questionnaires, and 3 telehealth visits. High engagement was defined as 80% or greater, and low engagement was less than 80%. 35%, or 12 participants, demonstrated high engagement, while 65%, 22 participants, demonstrated low engagement. The percentage of patients achieving the 5% or greater weight loss goal was compared between the high engagement and low engagement groups using a chi-square test. Achievement of the weight loss goal was defined as a 5% or more body weight reduction. 100% of the high engagement group achieved the weight loss goal, while only 59% of participants in the low engagement group achieved the weight loss goal. These results were statistically significant for an association between engagement level and achieved weight loss goal. In addition to analyzing engagement level on achieving the weight loss goal, mean weight loss outcomes between the high and low engagement groups were analyzed using Welch's t-test. While participants in the high engagement group demonstrated superior weight loss outcomes, the mean difference between the groups was not statistically significant. Conclusions at the completion of the project are that utilization of the healthy engagement tool had statistically significant weight reduction, increased adherence rates, and increased patient satisfaction compared to patients who did not have access to the engagement tools. In addition, patients with higher engagement are more likely to achieve weight loss goals compared to those with low engagement. Based on the results, the use of engagement tools in telehealth has significant potential to address the complex challenges of chronic conditions such as obesity. Future research is needed to explore long-term outcomes, the scalability of such programs, and strategies for further enhancing patient engagement, not only for obesity management, but other chronic conditions. The findings from this project have practical implications for healthcare providers, particularly those managing obesity through telehealth platforms. Considerations for practice include the integration of patient engagement tools in telehealth for the management of obesity and other chronic conditions, allocation of resources to develop comprehensive, patient-centered engagement tools, and the development of educational resources to inform patients of the benefits of utilizing engagement tools and becoming active participants in their care. This project was eye-opening regarding the potential benefits patient engagement tools can have on healthcare, especially in the treatment of obesity and possibly other chronic conditions through telehealth. Again, I would like to express my deepest gratitude to my project team, Dr. Eleanor Howell, Dr. Andrew Frige, and Dr. Timothy Iliff, for their guidance, encouragement, and support throughout this project. Their expertise and contributions were essential to the success of this work. I'm profoundly grateful to my dedicated staff at Omnia Telehealth for their assistance and support in implementing and managing this project. Their hard work and commitment were instrumental in bringing this vision to life. Finally, I would like to thank my husband, children, and family for their unwavering love, patience, and encouragement. Your steadfast support has been my anchor throughout this journey, and I am forever grateful for your belief in me.